Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk about schizoid personality disorder. And if I were to characterize the hallmark features of this condition, individuals tend to be more reclusive, distant, and aloof. But we're going to talk about the common features, the diagnostic criteria, some of the explanations for this condition, and some limited treatment approaches that have been tried. So without further ado, let's talk about schizoid personality disorder. As noted before, schizoid personality disorder is characterized by persistent avoidance of social relationships and limited emotional expression. These individuals tend to be withdrawn and reclusive and have very limited ties with other people. But it's because they genuinely prefer to be alone. It's not that they're afraid of judgment, as we talked about in paranoid personality disorder. There is a sensitivity to criticism. In this condition, there's kind of like an apathy. Praise and criticism don't have any meaningful impact on them. Now, people with schizoid personality disorder tend to focus on themselves a lot, tend to be in their own head, and others oftentimes view them as kind of flat, cold, humorless, and dull. This condition affects fewer than 1% of the population and is slightly more common amongst males relative to females. So let's go into the DSM criteria for this condition. So the DSM-5, as with all personality disorders, requires a diagnosis at 18 years or older. This condition has to be a chronic condition of 6 months or longer, although because it's a personality disorder, it's going to manifest throughout one's lifetime. Now, in terms of the actual symptoms, you need 4 or more of the following criteria. A person may show no joy in close relationships, no satisfaction in being part of a family, enjoys solitary activities, has little or if any interest in romantic or sexual experiences with another person, takes pleasures in very few activities, have very limited close friends and confidants other than their first degree relatives, tends to be indifferent to praise or criticism of others, right? And they tend to be more detached. Now, you need 4. You don't have to have all of these, but you need 4 out of 7 of these. The more you have, the more severe the difficulties are going to be. Now, we also rule out other conditions that might manifest this way with this kind of flat affect and reclusive way. We cannot diagnose a person with schizoid personality disorder if it's exclusively during the course of schizophrenia and active symptoms of schizophrenia, bipolar, a depressive disorder with psychotic features, autism, etc. So this has to stand on its own. Now, when we think of people who have schizoid personality disorder, they tend to do well in jobs that they can do their own thing. They can work on their own. So in computer sciences, lab sciences, people with schizoid personality disorder do quite well. So it's not that they can't have a job, it's just that they'll do better in jobs that they can be on their own. Now, how do we understand the development of schizoid personality disorder? From a psychodynamic point of view, object relations theorists link schizoid personality disorder to an unsatisfied need for human contact. It's suggested that the parents of these individuals might have either been abusive or unaccepting of their children. So as a function of that, they shut down and become apathetic. Cognitive theorists suggest that there are some errors or deficiencies in one's thinking. In this regard, thoughts tend to be more vague, empty. People have difficulty reading their environment and developing accurate perceptions. So let's talk about treatments. Before I talk about treatments, it's very, very important to understand that because of the extreme social withdrawal, many people with this disorder, do not enter the doors. They don't wind up in therapy as much. So their social withdrawal keeps them out unless something else or someone else pushes them into therapy. And even if they wind up in therapy, patients are going to be more emotionally distant from the therapist. They're going to be apathetic, or they wouldn't care much about the treatment process, and in many cases make limited progress. But that doesn't mean we shouldn't try. And here are some approaches that we do. So from a cognitive behavioral point of view, the goal is to increase positive emotions and develop more satisfying social interactions. So from the cognitive end, you're focusing on one's thinking about emotions and helping people develop an appreciation for pleasure and joy. From a behavioral point of view, we're teaching social skills. Now, another place where you could learn to engage the social environment is group therapy. Now, group therapy is a nice environment, a safe environment for people to have some social contact without any potential threat. Drug therapy, similar to paranoid personality disorder, drug therapy is of limited benefit because this condition is more about social distance, not emotions or whatnot. So we do prescribe some medication, but it's usually to treat other issues that coexist with schizoid personality disorder, not the condition itself. So I said you can have some limited progress, but so you have to be in therapy for a while. Eventually, it's going to lead to some degree of improvement. It may not be a lot, but it will lead to some degree. And it is difficult. It is a difficult process for the therapist and the patient, but the therapist has to strike a balance between empathizing with the patient and their dependency and challenging their way of thinking, right? Because you're going to have some countertransference here. You're going to have a reaction if your client is kind of meh all the time, apathetic about their progress or what they're doing. But nevertheless, the best approaches are some object relations therapy from a psychodynamic point of view for attachments and bonding, some cognitive behavioral therapy, some group therapy. That is schizoid personality disorder. So if you like this video, if you found something interesting, if you learned something new, please, please, please give me a big thumbs up, hit that like button, subscribe, click the notifications tab. These are important for the YouTube algorithm so that they know that there's some value in this video and they will push it out to a larger audience. And that will help me fulfill my mission of making psychology more accessible. But in addition, I would love if you could write a comment. I view my channel as a learning community. So if you have a question, comment, reaction, I read and respond to all of them. So please put it down below and I will make sure to get back to you. So until next time, take care, everybody.